I'm going to give a talk here in Paris at this meeting, at the COMy meeting on supportive care. And I think supportive care is of course, paramount importance in myeloma because it can reduce mortality. It certainly reduces drug discontinuation or treatment delays. It improves quality of life and therefore is one of the essential parts of managing multiple myeloma patients. And what is important is we need to accept that still in those days, with new drugs and new treatments available, we lose about up to 20% of our patients due to infections. We lose them very early on when we start therapy, but during the entire course of the disease, the mortality is in 20% of our patients probably due to infectious complications. And so if we can reduce that, that would probably improve outcome and survival outcome. But supportive care is also important because if patients have, you need to avoid polyneuropathy, peripheral neuropathy in your patients. You need to prevent reactivation of viral infections, and if there are viral infections, you need to diagnose them accurately and to manage them. You need to prevent thromboembolic complications as much as you can, and if thromboembolic complications occur, you have to deal with them. You need to treat diarrhea, which can be very burdensome to individual patients because some patients on the long-standing lenalidomide treatment develop something which we call bile acid absorption syndrome, so they have reduced resorption of bile acids, which leads to diarrhea, and there's a drug which can mitigate the diarrhea in those patients, which is called colesevelam. And so people should know about this opportunity or this option and use it if patients, if there's a suspicion that patients have this sort of diarrhea. And there are many other questions you should deal with. For instance, some drugs induce rash when you start treatment. And rash usually is mild, but it can be severe. In very few patients, you have to be aware that it can even be, let's say, life-threatening. So you have to know how to deal with these things. And you have to know how to deal, for instance, with hypercalcemia and several other issues. In my opinion, we made, of course, great progress in terms of increasing overall survival, which is due to new drugs, better drugs, but also due to better management of patients with myeloma. Those patients are now managed in centers which are specialized for myeloma patients, and that was completely different 20 years ago. And those specialists, of course, have some expertise and significant expertise in managing these complications as well. So improvement in survival is is of course due to better drugs, but also due to better management of complications and side effects of the disease and of treatment.